Welcome to WWP Genetics. We're thrilled to have you join us for another engaging and informative video. Today we will be discussing the impact of cannabis use. During pregnancy and lactation, pregnancy is a time of excitement, anticipation, and careful decision making for expectant mothers as they take extra precautions to ensure the health and well being of their developing baby. Foods like sushi, deli meats, raw eggs, and unpasteurized dairy are typically avoided, while many medications and therapies, such as massage and acupuncture, are often contraindicated, especially in the early stages of pregnancy. But what about cannabis use, whether for medical or recreational purposes? As more countries legalize cannabis for medicinal use, the question of its safety during pregnancy and lactation has become a growing concern. Pregnant women are often prescribed medications by their doctors to manage various conditions, and it's well established that most drugs can cross the placenta, potentially affecting the fetus. This is why it's critical that any medication taken during pregnancy is deemed safe for both the mother and the baby. Historically, caution surrounding pharmaceuticals in pregnancy heightened after cases like thalidomide, prescribed in the 1950s for pregnancy-related nausea, which tragically caused severe birth defects. Similar fears resurfaced about a decade ago when some blood pressure medications were linked to an increased risk of heart and nervous system defects in newborns. With these concerns in mind, it's understandable that questions arise regarding cannabis use during pregnancy. Cannabis is widely used across the globe, both recreationally and medicinally. It is often prescribed for conditions like chemotherapy-induced nausea, vomiting, and loss of appetite. Given that 70% to 80% of pregnant women experience morning sickness, it might seem logical to consider medical cannabis as a potential remedy, especially for women who struggle with severe nausea. The active compound in cannabis, THC, tetrahydrocannabinol, has well-documented antiemetic properties that can help alleviate these symptoms. In fact, a statewide study in Colorado found that 70% of cannabis dispensaries recommended cannabis for pregnancy-related nausea during the first trimester. However, despite personal opinions or anecdotal reports that cannabis might be safe during pregnancy, the reality is that scientific research on the effects of cannabis on fetal development remains limited. We do know that smoking anything, including cannabis, can increase the risk of birth defects, reproductive harm, and even cancer. But beyond that, much remains unknown about how cannabis, particularly THC, affects the developing fetus. On the other hand, patients who use medical cannabis instead of prescription opioids often experience fewer unpleasant side effects, which adds another layer of complexity to the conversation. Should expectant mothers opt for a treatment with fewer immediate side effects, even if the long-term risks are unclear? The American College of Obstetricians and Gynecologists, ACOG, advises that women who are pregnant or planning to conceive should discontinue marijuana use. They point to the lack of sufficient data on the effects of cannabis during pregnancy and breastfeeding, cautioning against its use until more conclusive evidence is available. Studies have shown that THC can remain in breast milk for up to 6 weeks after use, and daily consumption may slow an infant's motor development, though cognitive delays have not been definitively linked. For mothers in regions where recreational cannabis is legal, there's also a potential legal risk involved. Smoking cannabis during pregnancy or after birth could lead to serious legal consequences if caught. If you are using medical cannabis and discover you are pregnant, it is essential to discuss your cannabis routine with both your prescribing physician and your obstetrician. Navigating pregnancy while managing medical conditions can be challenging, but open communication with healthcare providers ensures that the health of both mother and baby remains the top priority. In summary, while cannabis may offer benefits like alleviating nausea and reducing the need for opioids, the lack of concrete data on its safety during pregnancy and lactation calls for a cautious approach. Expectant mothers are encouraged to consider all factors and seek professional medical advice when making decisions about cannabis use. Thank you for tuning in. We hope you found today's video informative. Don't forget to subscribe, like, comment, and share to stay updated on our latest content. For more exciting insights, be sure to check out our brother channel at WWP Logistics. See you in the next video.